This is our patient Misty, and Misty is demonstrating something called the Fukuda Stepping Test. And in this test, we have the patient step between 50 and 100 times in this kind of marching sequence with their hands outstretched. There are different ways to do it, but this is the way we do it here in this office. And what we're looking for is the direction that the patient turns. In this case, she's turning to the right, which indicates some kind of vestibular or cerebellar or proprioceptive dysfunction. Look at her face when she recognizes how much she's turned.
Oh.
After treatment, notice how now Misty's turning to the left, indicating that we've stimulated her right cerebellar vestibular mechanisms to a point where now it shows as if her left vestibular systems or cerebellum are dysfunctional. Notice how I start to run towards her because I'm worried she's about to run into the desk.
I went the other way. Oh my gosh.
March, eyes closed.
This is Misty's second office visit, and before treatment we're checking in to see what's normal for her. And once again, she's turning to the right. This is repetitive of her first time she was in the office. Anything past 20 to 30 degrees is considered a positive test. And some of you may be wondering why we keep earmuffs on them. We keep earmuffs on because patients will have a tendency to orientate themselves to sound outside of the office, and obviously we don't want them to do that. We performed some treatments on her, but she still rotated right. We performed some cerebellar exercises. Here we adjusted her sacrum and her ankles. What we're doing is we're doing an exam and treatment and then repeating the exam to see what impact it has on our nervous system.
Oh goodness.
This is her Misty's third visit, and what we see here is she starts to turn to the left. And then we perform some treatment, some cerebellar exercises, and some low back adjustments. She's a little more steady. Now she just deviates a little to the right.
Now we're to the right.
And here we had done some more cerebellar exercises and an upper cervical adjustment. And notice how she's turning to the opposite direction now. This is where we did a distraction of her mid-thoracic area. And notice how she's staying more midline here. The reason the lights are off is I had forgot to turn them back on when reshooting this segment. See how excited she is?
Oh my gosh.
Perfect. Perfect.
This is her fourth office visit, and before treatment, once again we're checking in, and she's turning right, which is what she has a tendency to do. And here she's past the 20 to 30 degree mark. So we did some cerebellar exercises, and now we did right-sided cerebellar exercises, and now she's turning left again. Such a great case, actually. Look at her face.
Alright, do this for me. You ready? This hand. Remember our fingernails last time?
Yes.
Same thing.
Here what we try to do is a finger-to-finger exercise, a cerebellar exercise on the left side. And I perform the exercise and then we redo the test, and I want to see what impact it has. And it had no impact. So I thought we'd try something different. And here we put on her back and do an optokinetic test with some muscle testing to see what impact it has upon her reflexes. It's a flexor withdrawal reflex with this optokinetic test. After that, we do the Fukuda Stepping Test. And here she passed the test. I got her back on the table
Go.
and actually did some sacral adjustments and distraction. And after that great exam, why would I want to retest? I wanted to retest to make certain that the patient's nervous system was acting appropriately. And here we can see that it is exactly what we want. I hope you got value out of this video, and I hope it was educational to you. Thank you.